Good morning, everyone, and I hope you had a good long weekend. Once again, I want to thank Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, for faithfully being here, and all his efforts in partnership with the City of Springfield, and to his staff and family. Good health for them. Dr. Robert Roos is unable to attend today. He does have a statement in which I will read that statement. And again, after Dr. Kerouac and Dr. Roos's statement, so Dr. Kerouac can get back to his important duties at Bay State, we'll take questions from the media and press and comments for Dr. Kerouac. I'd also like to thank the media, the TV, print, radio media. You've been fantastic partners in getting out pertinent information that's extremely important to our residents of the City of Springfield, business community in Western Massachusetts. Thank you very much. I'd also like to say thank you to our sign language professionals. We have two new individuals today. I saw sign language professionals Saturday when I was with Governor Baker, so we appreciate those efforts. Before I go any further, I'd like to take a moment of silence for S. Presley Blake, the co-founder of Friendlies, who passed away last week at 106 years old. He was a legendary, not only shrewd businessman, but philanthropist who has given millions and millions of dollars to causes across the Springfield community. And everybody knows how much they enjoyed the original Friendlies. So we just have a moment of silence in remembrance of co-founder of Friendlies, S. Presley Blake. Thank you very much. I'd also like to thank Focus Springfield for being able to stream this live. I appreciate that very much. And also to my cabinet heads and to rank and file and their families. They've been tested and true through a number of natural and man-made disasters, and I appreciate their efforts immensely. We'll go to the stat sheet. Total confirmed COVID-19 cases since the start of this surreal ordeal, 16,748. Weekly is ticked down to 531. Monthly is also ticked down to 1048. Unfortunately, we had, as Commissioner Carlton Harris had indicated last week, more deaths, unfortunately, going to occur. Springfield residents, we had 10 more deaths that occurred. That brings a total of 209. And again, our thoughts and prayers and sympathy and encouragement go out to all the affected family members of those individuals. Mr. Carlton Harris will speak a little bit more about those individuals when she does her report. Of that, white were 87, which comes across as a 41.6%. Black was 46, which comes across at 22%. Hispanic was 69, which comes across about 33%. Asian is 7, which comes across at 3.3%. The majority has been for the last few months, or a number of months, are residential, 150 passing away. We did have one, first one in a long time, long-term care facilities, which brings it to 59. I'd also like to indicate AMR, and Patrick Leonardo is here, the Director of Operations. They've been just an outstanding partner with the City of Springfield, and we deeply appreciate it. The Eastfield Mall Stop the Spread, Governor Baker Stop the Spread testing is off for today, as is, we're partnering at Rebecca Johnson. That will not take place because at the time we did not know what the weather was going to be. Icing. As we continue to stand up Rebecca Johnson, Putnam Vocational, and Kennedy Middle School with Commissioner Helen Carlton-Harris and AMRs, we're trying to make it much more convenient for our Springfield residents going to the neighborhoods. We're hopeful that we can do the same if we get an allocation of the vaccine also. But Patrick, thank you very, very much. I was with Governor Baker. He did his Commonwealth update Saturday at the Eastfield Mall, the vaccination site with Curative. And I have to say that since we intervened and made some strong suggestions and collaboration with Curative, Dean Schultes and Dave Thompson at Eastfield Mall, we've received a number of calls and reach out even up there. The seniors very, very happy. It's running much smoother, so I was happy that I was able to intervene with that, and the seniors are now happy. We just got a report earlier this morning. CVS is going to start giving the vaccination. The Springfield location is 1242 Parker Street, up in the Acres, and you have to go to the CVS website, and they're going to start giving out the COVID-19 vaccine. As stated before, Commissioner Carlton-Harris and I and Dr. Kerouac, Mark Kerouac, are prepared, if we can get our allocation of vaccines, to partner again and try to get to neighborhood vaccination sites for our residents and working with Bay State. If, and hopefully we do get some of our own allocations for the vaccines as the federal allotment hopefully is picked up more and more. 801 seniors have been assisted through our libraries, Molly Fogarty, our senior centers, Sandy Federico, and Health and Human Services, Helen Carlton-Harris, in booking appointments. And again, we have 2-on-1 is now online from the governor of the state, and Sheriff Cochee, Nick Cochee, is online. So the seniors are being helped out. We're also going to speak of, Helen will speak of the scams that are going on right now to try to scam our beloved seniors. And again, as I said last week, and I think Helen will reinforce that, as will Commissioner Clapper, to our seniors, please, do not go with anyone that you do not trust, that you do not know. Do not pay for anything. Do not give out any information. People calling on how you can get your vaccine. There is no charge for your vaccine. And shame on those individuals that want to perpetrate these negative crimes to our senior citizens. We'll continue. My Office of Consumer Affairs with Millie Johnson and AG Maura Healy and local authorities, Mr. Clapper, DA Gallooni, if we're able to find these individuals, to prosecute them at the fullest extent. But again, to our seniors, please, if someone calls, say they can give you a ride, or they can pick you up, or they're looking for information, you don't give them anything, you don't give them any money, and you don't do anything with them whatsoever. We don't want them to perpetrate even more negativity to our senior population. Speaking of our seniors, the home meal deliveries continue to our senior citizens. I'm deeply appreciative of that with Vanpool and Pat Sullivan and Tedesco and others in the Elder Center. Some quick updates. I want to thank the Republican, George Arwadi and Cynthia Simpson and crew. They did a wonderful job on the outlook, economic development, post-COVID-19 vision, stressing it what's going to go on in Western Mass, but especially Springfield. We appreciate that. Tim Sheen and I deeply appreciate that. Eastman, another good corporate citizen. They stepped forward. Superintendent Warwick will speak about that. Making they made these well over 1,000 laptop desks for our students. And they're not that you put on your lap. It is literally a plastic desk that they made that you could prop up no matter where you're sitting, on your bed, in a chair, on a table, for all the laptops, nearly 20,000 laptops and iPads that we've given out to our students. So Again, I want to thank Gianna Alatuk. She's one of the counselors at Brookings School. She's always, her heart and soul was always with our students. And I'd also Vice Chair Chris Collins and Tony Signoli, who does the PR work for Eastman. Really cool what they did. It's going to be very helpful to our students. I happen to be wearing United Way 211. Our call to talk is now in the western part of the state through Springfield, and that's to mental health and other situations where people need assistance, and sometimes all it takes is a phone call to talk to somebody. I want to thank Paul Mina, the Executive Director of United Way Springfield, and we're partnering with Springfield College President Mary Beth Cooper. Her students, her grad students who are in the mental health and that field are manning the phones, and we had done a Zoom conference with Lieutenant Governor Polito. The Oasis Food Bank continues with John Foley, Sedesco, and the Food Bank of Western Massachusetts. We are serving up to 3,500 families every Friday at Central High School, and we work with our police department, DPW, on that also. I want to wish a happy Lunar New Year to our Chinese population, especially our Vietnamese Americans, who have been so kind to me and very industrious. It is the year of the ox, so we wish them a happy New Year. Give a shout out to Eileen Quinn Handley, just retired, 40 years of service to our city. We did a little Zoom proclamation for our city departments and finished up at retirement, and we appreciate that immensely, Eileen, and wish you good health. Thank you, Eileen, very much. We celebrated with President's Day, and we celebrated with the Daughters of American Revolution. Holly Blair and her team, they do a fantastic job. The 289th birthday of President General George Washington. Again, he was instrumental in siting the Springfield Armory here back in the late 1700s. We are one of 37 statues in the world. It's a Holy Name Church area site, and we did that Friday. To all those of the Christian Catholic faith, Ash Wednesday is tomorrow. Lent is going to begin. Symphony Hall upgrades. Look forward, could be this week, to give the update on the wonderful entertainment lighting, audio, and physical plan improvements. We hope to unveil that to the media sometime this week. Very high tech. I'll be getting an update on other partner, STIC President John Cook, later on this week. And to the Sabbath School Honor Roll, Zoom greetings, congratulations, Advisor Brendan Dwyer, and to all the students there. As they brought greetings to all their honor roll students. Quickly on the last thing with Helen Colton Harris and I, DPH Commissioner Lana Correll had reached out yesterday, and Commissioner Colton and I will be having a phone call with her today. Is our messaging getting out on trust of the vaccine, the safety of the vaccine, and partnering together. So we look forward to that conference call, that Zoom call. On the police side, Commissioner Clapper, Cheryl Clapper indicates there's only 4 down with COVID, which is very good. She'll speak to you that they moved back to 2-person cars now. A quiet weekend, knock on wood. And we continue our meetings with the Department of Justice to work out an agreement on initiatives and continued police reforms. Commissioner Calvi from the Fire Department indicates 3 are down with COVID-19. He'll speak to you about 2 arson arrests that were made just recently, and also about ICE safety. DPW Director Chris Signoli, there's 1 down on COVID. We are very happy. Unlike other parts of the nation, he sort of dodged a bullet today with the stormy weather, but he'll give you an update on possibility of another storm this coming Thursday. Superintendent Dan Warwick, again, school vacation week this week. Meals, we have served 6,131,508 meals to our students and families since the start of this COVID-19. That is breakfast, lunch, dinner, and snacks. Over the weekend, over 106,556 meals went out to our students and families. Danny will give you an update, as will Director Pat Sullivan, continue retrofitting of our schools, and an update on the hybrid reopening type aspects. School sports, school committee meeting we had the other evening. They are back in session, and we also voted to move forward on spring sports, which would include a football season. Superintendent Warwick will speak of that. Of course, the Eastman, the laptop desks. Finance side, our Chief Administration Financial Officer, CFO, TJ Plan indicates to me since start, 7.6 million in deficit. I'm down about 2.8 million for FY21. We have spent in deficit and grants $31.3 million to provide for our residents and business community of the city of Springfield. 7.8 of that is a deficit. We've been able to pawn off $23.4 million on grants, and as I have done with past natural and man-made disasters, I will continue to go after every dime of reimbursement available for our residents and our business community. We'll continue our budget preparation for FY22, and we'll continue to track the legislation on the federal level with Congressman Chairman Neil Ritchie, what President Biden has put forward as possibility that reimbursements of FEMA could be 100%. That's why we track all our costs. That'd be fantastic. During the tornado days, those reimbursements were 75%, and many times we'd have to appeal 4 to 6 times to get that money. So that would be great news if that occurs, and we appreciate the Congressman's efforts with President Biden and Vice President Harris's pitch to Congress. Parks and facilities, Director Sullivan indicates to me that nobody is down with COVID-19, which is fantastic. He and his team have done yeoman work on continuing to retrofit our schools and our buildings. He'll speak to you about ice safety. He'll also speak to you that Sear Arena is back open, and that opened up. Echo Dev, Chief Development Officer Tim Sheehan. There's nobody down with COVID there. It's fantastic. Tim will give you an update. He continues to monitor very closely the federal and state relief stimulus packages pertaining to COVID-19 as we look to see what more we can get out to our business community and residents in need. He'll also speak to you about the Community Foundation. Katie Zobel and crew, we want to thank you. I guess they've given out about $10.2 million in grants. And Timmy will talk to you that a lot of that money went to Springfield nonprofits, which is fantastic, so they can continue to provide to our residents and families in need. Law, HR, Labor, Eddie Solicitor Pakula and Attorney Bill Mahoney. One down with COVID, the Law Department. Ed, we continue our DOJ meetings. Solicitor Pakula, also we put out an extension on the marijuana bids for recreational, cultivation, and delivery. We extended it, I believe, for another week or so for more questions to come in as we look forward to that new entrepreneurial business expanding here in the city of Springfield. With that, let me just briefly read Dr. Roos's statement, and I'm going to turn it over to Dr. Kerouac. And again, Dr. Roos expresses his regrets. We appreciate he's been a Mercy and Trinity Healthcare, as with Bay State, have been very good partners to the city of Springfield. So this is from Dr. Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare. Good morning, everyone, and please excuse my absence today. Unfortunately, I am not able to be there in person, but my attendance was required at a key regional leadership meeting today with Trinity Health of New England. I do want to thank you, Mayor Sarno, for your ongoing leadership, and my regards to your entire cabinet for their collaboration and leadership as we have partnered together throughout this year to educate, protect, and now vaccinate the community. There has been a lot of news related to COVID this past week, from vaccine supplies to variants, but we always do with our science-based approach. We start with the data, and the trends continue to be positive. For the 5th week in a row, we have seen a significant reductions in the number of new infections, hospitalizations, and deaths due to COVID at the national, state, and local level. Across the country, the number of new cases per day has dropped another 40% over the past 2 weeks and is now approaching the level we saw during the second wave in the summer. This is now about 80% lower than the peak on January 8th. Hospitalizations have also declined 30% during the same period, and the deaths are now just under 1,000 a day. Here in Massachusetts, Dr. Luce goes on to say, the trends continue to reflect the national trends. The average number of cases per day has dropped to below 1,500 and is 75% lower than the peak of January 8th. And the total number of hospitalization cases is below 1,300 for the first time since early December. And of note, the test positivity statewide has continued to go down and is now just over 2%. At Mercy Medical Center, the number of hospitalized patients we are caring for remains much lower than at our peak. But we have plateaued somewhat and did not see a significant decline this past week. And as of this morning, we have 19 patients hospitalized with COVID, with 6 in intensive care unit. And while our test positivity rate does continue to remain higher than the state average, it continues to go down and is at 6%. And we are certainly encouraged by all these trends, and most notably, the reduction of severe illness from COVID. Now regarding the vaccines, again from Dr. Robert Roos. At Mercy Medical Center, we are proud to have provided over 6,400 vaccinations to more than 2,200, having already completed their full series. Last week, as you may have heard, hospitals were advised by the state not to schedule any more first dose vaccine appointments due to limited supply, as the allocation of vaccine was being shifted to mass vaccination sites, such as the Eastfield Mall. We are disappointed to hear this news, as we believe that we have demonstrated our ability to run high-quality, safe, and efficient operation. Just on a side note, I did speak to Governor Baker on that, and again, he had indicated if the uptick comes from the federal level, to make sure that the hospitals also are going to continue to receive their fair share. So hopefully that federal level will continue to uptick. We also believe the hospitals and healthcare systems play a critical role in ensuring that all communities are served and have access to the vaccine, particularly those who may have transportation difficulties or have hesitancy about the vaccination. And we at Mercy are eager to be part of the planning with the state regarding decisions with the vaccine rollout going forward, as is Dr. Kerouac, who we spoke Friday morning also. At the beginning, and with that being said, we want the community to know that while we are not scheduling any new first dose appointments, if you already have a first or second dose vaccine appointment at Mercy Medical Center Vaccine Center, that will be honored and you should proceed as scheduled. Do not worry about that. We fully expect to have the vaccine we need for all scheduled appointments and are hopeful to open up more first dose appointments in the near future. As always, please refer to their website, which is www.trinityhealthofne.org/vaccine for the latest updates. Additionally, while there is news that variants are spreading across the country, the same guidelines remain in place, and there is more and more evidence that our vaccines are safe and highly effective and are already leading to reductions of hospitalization and deaths. They truly are the path to emerge from this pandemic safely, and we will continue to push for supply and capacity to increase over the coming weeks and months. In closing, We at Mercy always make priority your safety and well-being. Please continue to do your own part and follow the life-saving precautions, always using a properly fitting mask, keeping physical distance, and staying safe to protect yourself and loved ones. Thank you, and again, this is penned by Dr. Robert Roos, the Chief Medical Officer of Mercy Medical Center. Thank you very much. Without further ado, I will bring up the President and CEO of Bay State Health Systems, who's been a great friend and a great partner to the City of Springfield, Dr. Mark Caraway.
Good morning, everybody, and thank you again, Mr. Mayor, for this opportunity and for all the work you've done to combat this pandemic. As Dr. Roos said, the rate of new COVID-19 cases has continued to decline across the country and across the state. I'm not going to reiterate all of the statistics he shared. I will point out that yesterday there were only 54,000 new cases, only 54,000 new cases in the United States, but that's down from 250,000 around the time of the holidays. Hospitalizations have been consistently below 100,000. Yesterday they were at 78,000, which gives a little bit of headroom, a little bit of comfort that we are not going to run out of beds or ICU accommodations. New cases in this state have been below 2,000 a day for many days now, and hospitalizations have dipped down below 1,000 for this first time in many months. Interestingly, Hampden County is not coming down as fast as the rest of the state, and therefore our relative position to the other counties has gone up. We are at the second highest rate among the various counties after Bristol County down in the Fall River area. Just the same, new case rates have come down about 20%, but that means there still is a lot of virus around. Bay State Health's COVID burden has declined to below 100 for the last several days. Today we're at 88 cases in the system. 78 of those are in Springfield, 10 in our community hospitals, and 13 require critical care. Our test positivity rate is about 5%, and that's the lowest it's been since November. I'm going to put in another brief plug this week for the monoclonal antibody treatment. This is the treatment that President Trump received and that he was touting as having helped him a lot. It is clearly superior to the plasma treatments we were using back in the spring. It is indicated for people at high risk, so that would be over 65 or chronic diseases like high blood pressure, diabetes, obesity, shortly after you get infected and before you feel really sick. It can cut the rate of hospitalization at least in half, if not more. And so something to talk to your doctor about if you are unfortunate enough to receive that diagnosis and be in one of those high-risk groups. I'm also going to share that last week we received the news that the CDC had issued an operational strategy for the K-12 school openings. This is based on a knowledge of virus transmission in school settings, which seems to be less. It's harder for kids to catch this disease, and they shed less of it when they do. It's also based on the success of many large school districts, including New York City and Providence, Rhode Island, in keeping schools either partially or completely open. I raise this because we are seeing at Bay State the impact on the mental health and development of children. And it's really serious, and I think that needs to be considered in any of these reopening decisions. This strategy for reopening, this operational strategy, is sort of a touchstone document. It has a variety of toolkits and checklists, and it gets us past the whole idea of opinion or insisting that things are perfect before we think about reopening schools. It's based on a layered approach that includes consistent mask wearing, social distancing, hand washing, improving ventilation, and testing. It's clear that the risks are lower in the elementary school group than in middle or high school groups. The document prioritizes learning over extracurricular activities, and it also links the advice to community risk. Right now, Springfield is in the second of 4 severity categories, the second highest, so-called substantial. But even at the very highest categories, the ability for kids to return in a hybrid approach is advised. It's important to keep a virtual option open for high-risk students, for high-risk parents, or for high-risk families as well. Vaccine is said to be a priority for teachers, as it is in Massachusetts. Teachers are part of Group 2, but it's not a precondition. So I personally believe this is an important document for anybody who's planning in this space. It's available at cdc.gov. I understand these are very tough decisions, and people have all different kinds of opinions, but I'm happy that the guidelines have been issued, and I hope it'll move many school systems to open sooner. I say this again because we at Bay State are seeing increased mental health problems, suicide attempts, not to mention the loss of milestones for kids who have now been out of school and isolated, many of them for up to a year. And this is, of course, worse in lower socioeconomic groups. Let me move now to the issue of vaccination. We are still in phase 2, meaning people over the age of 75 are the folks who are eligible for vaccine in our state. The United States has given over 52 million shots. Over 38 million people have received at least one dose. Massachusetts has administered over 1.1 million shots via the state-based program and nearly 370,000 shots via the federal program for nursing homes. About 3/4 of the 1.5 million doses that have been allocated to the state have been administered, and Massachusetts continues to get between 100 and 110,000 doses per week. So that allocation rate has been pretty flat for the last few weeks. The number that I look at is the velocity. How quickly are we getting shots into arms? And that is the one thing that I calculate every week when I see the vaccine report. The average for the last 7 days, based on last week's report, is that we are giving 32,000 shots per day. That's an increase. We were in the 5,000 to 10,000 shot range about a month ago, but it's still well short of the 41,000 first doses and 41,000 second doses that we need to do each day to hit our goal of getting all adults vaccinated by the summer, by June. As Dr. Roos noted, we got word last week that the state was placing a priority on mass vaccination centers and asked the hospital-based centers to hold off on booking any more new appointments for first vaccines. They initially said that they would honor second doses and already scheduled first doses. We subsequently heard, though, that Bay State Health was receiving our full allocation of 2,500 doses, including 2,000 first doses. That's for the week we're in right now. We heard that last Friday. This, of course, was welcome news, and it allows us to continue to advance, although just a little bit, our plans to increase vaccination in Greenfield, Westfield, the Eastern region, and in downtown Springfield. Our daily capacity is 1,500 shots per day, which is the same as the Eastfield Mall. However, we are not considered a mass vaccination site, and therefore we are not doing that companion program that's been in all the news. So that's an important thing for people to keep in mind, that if you're hoping to get a vaccine by bringing a 75-year-old, we're not going to be able to accommodate you at Bay State. We believe we could increase to 2,000 shots per day in a distributed model. A distributed model, which means all of the various areas in our region, including downtown Springfield, helps deal with people who struggle with transportation, who have challenges regarding mobility, and who are not facile with the internet. We have already helped hundreds of our elderly patients make appointments. So it's not easy, but we have been able to do it. Remember, the 3-county area in Massachusetts has roughly 10% of the state population. So we roughly need to do 4,000 first doses and 4,000 second doses every day to get the job done by June. I think we need both the Bay State program, the mall, and more if we're going to achieve the velocity we need to complete the job. We're hopeful that with the release of the Johnson & Johnson vaccine later this month, it's scheduled to go to the hearing on February 26th, we will be able to further our expansion plans. We believe we could either triple or quadruple what we are doing today. Increased speed with J&J would be because, number one, we have more supply, and number two, we don't need to do a second dose. So we could, if everything was J&J, we would only need to do 4,000 a day. Bay State Health has shown that we can administer 1,500 doses a day and likely more in an environment that's safe, efficient, customer-friendly, equitable, and open to the public. We appreciate the trust the state has placed in us, and we plan to continue to earn that trust. We also appreciate the support of our legislative delegation in advocating for Western Massachusetts. Until you're eligible for vaccine, remember, there's still a lot of virus around, even though the numbers are declining. It's no time to relax now on the public health measures of masking, social distancing, and avoiding crowds, especially indoors. Also remember, you still need to wear a mask after being vaccinated until the state relaxes the rules. So I'll end there, and again, thank you, Mr. Mayor, for the opportunity. And
The press is here, I know Mr. Russell for 2240 back down to that, so.
Hi.
Are you concerned at all about the fact that what Florida is finding out in Massachusetts is more behind us? They feel that other three counties do not appear to be this far behind?
Yeah, I think that the initial vaccinations were focused on healthcare workers, and pardon me, therefore those counties that had a lot of healthcare workers got a head start. Now, Hampden County's got quite a few healthcare workers, but nowhere near as many as Suffolk County. And they were up at, they were at some huge number early on. So I think the data has been skewed a bit because of the way they prioritized healthcare workers. Again, I'm keeping an eye on what are we doing going forward. I think of this almost like going for a trip in your car, right? There's nothing you can do to control how fast you went, 30 minutes ago, but you can control your current speed and how quickly you're moving forward. So I think if we keep our eye on the fact that we ought to be doing 4,000 first doses, 4,000 second doses every day for a 3-county area, we'll get to where we need to be pretty quickly.
And I also want to get your response from the other leaders on Saturday on you had asked if you disputed the reporting that the hospital was getting checked for cutoff for the first doses. And you said, no, what I'm saying is there's still a large share of people in Massachusetts. Hospitals for healthcare systems for community health centers that are getting half of all vaccines distributed next week. Does that sound correct based on what they say?
I think it's technically correct, but right off the bat, the hospitals were getting almost 70% of the total allocation, and that percentage has gone down as the mass vaccination sites have come up. So there are so our allocations have been flat. They've not been increasing, even though we think we could triple or quadruple our capacity. The other sites have been brought on and have been coming up. The relative proportions have been shifting away from the hospitals, even though the hospitals might be technically in first place.
Any other questions from media members? Go ahead.
The variants have continued to come. Because you have a lot of virus out there and there's this churn of replication, you're going to continue to generate variants. There have been several that have been described. The most common one in Massachusetts is the so-called British variant. There's always the risk that these variants will be more troublesome than the original strain. So far, it's looking like the same approaches to prevention seem to work, and that the vaccines appear to work as well, with the possible exception of the AstraZeneca vaccine for young people for the South African strain. So I think that it doesn't change our plans, and I think our focus needs to still be on accelerating vaccine administrations. I wouldn't defer vaccination. I wouldn't give up on the idea of all the preventive activities we're doing. Our own, sequencing, the genetic sequencing of variants is something that we don't do with Bay State, but we would send that out to a reference lab.
Any other questions from the media and the press?
Yeah, can you expand a little bit more on your as far as the mental health issues? And I know there was a report in the Times that really bad in Europe. I realize very much more serious lockdown cases than we are. Can you expand a little bit more on what you're doing there?
Yeah, I think that what we're seeing, what I'm hearing from our pediatric colleagues is that there are more kids who are coming in with depression, suicidal ideation, worsening of chronic mental conditions like autism. These all are an increasing burden on our providers, and I believe that they're linked to the social isolation that these children are experiencing.
Is there any symptoms more happening among adults as well? And I realize we're not experiencing the same level of isolation as I'm sure it's happening across the board as well.
Yeah, I think that there was actually a very well done study in depth of the effect on women caregivers in particular who are under the stress of keeping a household running, homeschooling, keeping a job, etc. So the stresses have been significant in all age groups, and the isolation is a burden in all age groups. In terms of how it manifests itself, we're just seeing a lot more of the problems in the younger age groups. Yeah, the Johnson & Johnson vaccine, number one, it would just be a third pipeline that's being opened up for the pool of vaccinations. How the state decides to allocate who gets J&J, who gets Moderna, who gets Pfizer, I think is still to be determined. It also relieves a second administration, so if to the extent that the rate limiting step is either personnel or space, you can get a lot more Johnson & Johnson vaccine into arms because it's a one and done. I would also add that the data for Johnson & Johnson are quite good. They're not, the prevention of any disease at all is a little less good than it is for Moderna and for Pfizer. However, the prevention of serious disease is still in the 90% range, which is really what people care about. I think it's very much like a flu vaccine when in any given year you get a flu shot and you get a little bit of a mild case of the flu. Yes, that's disappointing, but it's not going to change your world. What you really want to do is prevent yourself from being in the ICU or dying from it.
Any other questions from the media? Okay, here we Dr. Carewell. Thank you so much. Your health, you and your family and staff. Thank you, Doctor. I'm now going to bring up the Commissioner of Health and Human Services, Helen Carlton-Harris. She and I are very, very appreciative of our residents and business community continued cooperation, collaboration. I know it's been a difficult time and surreal time, but your partnership has been extremely important for us to continue to defeat this COVID-19, which we will. The Commissioner of Health and Human Services, Helen Carlton-Harris.
Thank you, Mayor. Once again, thank you for your support. I too want to add my voice to the mayor and thank the residents of the city of Springfield and the Western region for cooperating with us as we move forward with our prevention and mitigation strategies for COVID-19. I'm going to begin with this week's data for the city of Springfield. The February 7th, 2021 to February 13th confirmed cases on Sunday, 88. Monday 80, Tuesday 10, Wednesday 147, Thursday 52, Friday 73, and Saturday 81. Let me clarify that 147 includes 61 cases that should have been reported on Tuesday, but we had a systems glitch. And so that is the week for the COVID-19 cases in our city. The age groups, 848, 0 to 10, 75, 11 to 20, 103, 21 to 30, 31 to 40, 87, 41 to 50, 81, 51 to 60, 67, 61 to 70, 36, 71 to 80, 22, 81 to 90, 11, and 91 to 100, 1. The majority of the cases still remain under the age of 50. 42% were under the age of 30, and 32% were 31 to 50, which is 74% under the age of 50. 51 and over accounted for 26% of our cases. The line graph shows you where we are currently. In the month of February, we are at 1,084 cases by the line graph. The really important thing is that our cases have dipped 54.9% since our high of the week of January 3rd. So we are seeing a decrease in the cases that we've seen in the city of Springfield. We are headed in the right direction. However, we are not at the place where we can relax. There is still, as Dr. Kerouac indicated, a lot of community spread that is in the Hampden County area and certainly in the Commonwealth of Massachusetts. And so we will continue to push our mitigation strategies, but our total for this week was 531. We are down 107 cases from last week, and so that is good news. We want to continue to go in that direction. As far as our zip codes are concerned, there were 5 cases in 01101, which is 1%. 03 had 5 cases, 1%. 04, 106 cases, 20%. 05, 57 cases, 11%. 07, 37 cases, 7%. 08, 79 cases, 15%. 09, 101 cases, 19%. 18, 45 cases, 8%. 19, 40 cases, 7%. 28, 3 cases, 1%. 29, 30 cases, 6%. And 51, 23 cases, 4%. The race and ethnicity categories: Asian, 2%, Black African American, 16%, Latinx, 24%, White, 32%, Unknown, 26%. As the mayor indicated, we ended with 16,217 cases last week, and we added 531 for a total of 16,748 cases, 10 additional deaths. The deaths were a 98-year-old white female, a 77-year-old white female, an 83-year-old white male, a 92-year-old white female, a 62-year-old white female, a 75-year-old Hispanic male, a 71-year-old Hispanic male, an 88-year-old black female, an 84-year-old Asian female, and a 78-year-old Hispanic male. We want to again send our condolences out to the families. A loss in a family is something that we take very seriously, and our condolences are to the family. We tell you the age and ethnicity and gender of the individuals just so you can know that this virus is taking valued members of families in our community out of our ranks, and we believe that it can be prevented. Testing. AMR has tested 142,444 individuals. Springfield residents, 61,164, and the number of positives, 13,364. At New North Citizens Council, AMR tested 73 individuals, and at Rebecca Johnson, they tested 25 individuals. As the mayor indicated, Mason Square site will not be open today due to the weather projections. Also, Eastfield Mall is not open today because of the weather projections. I want to let you know that Eastfield Mall, as Dr. Kerouac said, is a stop the spread site. That means that all of the rules and regulations of a public site, including the companion portion that has just been added, will be honored at public sites. Here in the city of Springfield, we are standing up independent sites. Kennedy will go live tomorrow. The mayor is committed to testing and making sure all Springfield residents have access. And that's why he has directed that we use CARES funding in order to stand up those sites that are additional sites. These are not stop the spread sites. Any resident of the city of Springfield can go to these sites, but again, it is not a public site such as the one at Eastfield Mall, and that site will continue tomorrow. And so anyone can go to the Kennedy site, but we wanted to look at the city and where access was critical, and we believe that there are areas of the city where we can stand up sites, and we will do so when we are able. Want to make sure that individuals understand something about the new variant. Although obviously Dr. Kerouac talked about the new variant and its impact, we did see that there is one case that is in Hampden County, but the new variant really does remind us around COVID-19 and mask wearing. And so it's important to step back and understand that COVID-19 is spread through droplets that come from the nose, the mouth. It happens while we are talking, speaking, singing, sneezing. And so those droplets can get into the nose and mouth of another individual and therefore spread the virus. So when we ask you to wear masks, we're asking for universal mask wearing. Universal mask wearing means that you should wear masks whenever you are in public, when you are going to the grocery store, if you're in your house with someone that is not a part of your household, if someone in your own household appears to have symptoms, please use a face covering. We are trying to make sure that our residents are safe, but we can only do that if you help us, and help us by wearing face coverings and wearing masks and washing your hands and watching your distance. Those are the things that's going to get us through until everyone is vaccinated and herd immunity is a part of our environment. Elder Affairs assisted 235 individuals. The library assisted 251 individuals. Health and Human Services, 325. The mayor gave you that total, which is 801. I am grateful to the departments who stepped up and made themselves available to our residents in order to assist. Want to thank Molly Fogarty and her staff, Sandy Federico and her staff, and certainly the staff of the Department of Health and Human Services. The City of Springfield is in process of giving second doses to those we gave first doses to in our initial phase of rollouts. There is a sign-up, PrepMod has a sign-up. If you have not received your second dose or have not received an email from us scheduling your second dose, please do that. Call us, email us. We want to make sure that those individuals who require a second dose are in the queue to get their second dose. The City of Springfield is working with VaxForce, and we will be hosting a town hall the first or second week of March. That announcement will be forthcoming. We are also in the process of assessing non-school sites for vaccination sites, including houses of worship. So I want to thank those houses of worship who we will announce potentially next week for reaching out and saying that you will be a vaccination site. I will be working with Patrick Sullivan in facilities to assess these sites. When I heard from the houses of worship, what I said to you is that we will be making an appointment to talk with you as far as your site is concerned and any modifications that might be necessary. But I'm grateful because that works as far as our decentralized model is concerned. Getting to the vaccine into arms of community means that we must be in those communities, and we believe that is our commitment, is that we're making sure that we're setting up smaller sites in communities, particularly those communities that have been hard hit throughout this very difficult time and this pandemic. Again, we will start our site at Kennedy tomorrow. We are very grateful to AMR, who has really worked very diligently with us. I expect that we will continue to work together as we try to get vaccines into arms of individuals. So this is a very difficult time because we're watching our numbers go down slightly. It is important that we do not relax. It's important we continue to do the things that have our numbers going down. As Dr. Kerouac said, our numbers are not going down at the same rate as some places in the Commonwealth of Massachusetts. The city of Springfield was once a green city, which means that we as a city know how to mitigate this virus. We know the things that must be done. And so I'm once again asking you to be very vigilant. Understand that unless and until we achieve herd immunity, our mitigation strategies must stay in place. Watch your distance. That 6 feet is important. Wear your mask. Very important. Wash your hands. We are also working with Springfield Public Schools around testing our athletes. The superintendent will give you an update on that. I want to thank Lydia Martinez, A.D. Early, who was amazing, and of course Jeannie Clancy and the superintendent and Mayor Sarno for his directions. As you know, our athletes have been doing sports and they've been safe. And we want to continue to do that. So we are very grateful to have the opportunity. Thank you very much.
Helen, did you want to mention about, I know how passionate you were most
on the senior scam stuff? I know you want to
Yes,
speak on it.
yes, thank you.
Commissioner's very passionate about.
I did want to talk about, and I had a list here of, so thank you, Mayor, for reminding me of that. Yes, so there are scams going on with seniors. When the Commonwealth said that you can get a vaccination if you are a companion, that set off a litany of individuals who went to social media and started to fish for seniors 75 and over. And so some of the things that have been online will pay $200 to assist 75-year-old. Senior over 75 who needs COVID vaccine, free rides for seniors who need COVID vaccines, free pickup and drop off for individuals who need COVID vaccine over the age of 75, rider companion for individuals 75 and older. And it goes on from child care. It talks about not only child care, but it talks about getting a ride, paying individuals. So these are very concerning because this doesn't stop with this particular scam. Once an individual has your information and knows about you, they could continue to scam you in very different ways. Our recommendation is clear. If you do not know the individual who is your caretaker or your companion, please say no. Do not get in the car with someone that you do not know. We understand clearly that people 75 and older, and all of us, want the vaccine, and often we become desperate to get that done. I would please plead with our seniors, 75 and older, 65 and older, and anyone else, do not take a ride, do not take a phone call, do not give personal information to anyone that you do not know, because the consequences and the outcome could be detrimental not only to you, but to your family, and certainly we want to make sure we're keeping everyone safe. I want to thank the mayor for reminding me about this, because I am very passionate about keeping our seniors safe, as is the mayor, and all of our residents. Please be careful, be safe. We want you to get vaccinated, but we also care that health is physical, mental, spiritual, and emotional. And so we do not want individuals to take advantage of your emotional health at this time, in this very critical phase of our mitigation strategies of this virus. Mayor, thank you so much for reminding me of that.
Thank you, Mr. Faulkner. I know you're very passionate and emotional. We were talking about that, of trying to abuse our seniors. So thank you, Mr. Helen Colton-Harris. We'll now go to the public safety portion of the update, and I will bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calley.
Good morning, everybody. Thank you, Mayor. This morning at the Springfield Fire Department, we only have 2 members out with positive COVID results. We have an additional member who is isolating due to a family exposure. So that being said, we're in good shape at the fire department this week. These are some of the lowest numbers we've had in quite some time. I want to touch upon a couple other issues going on, one with ice safety going. It's going to be in the 40s today. It's been raining. If there has been any ice built up there, it's going to be softened up today and weakened. The ice is still unsafe to go on. We have not had enough prolonged cold weather to make the ice strong enough for ice skating or walking on. The ice has streams running under it in a lot of spots, so it's going to continue to weaken the ice, and it is not safe to be out in the ice, so I advise against that for anybody who had thoughts of pond hockey or any skating out in the ice. Next, we had a busy week last week in the fire department. We had 2 arson fires, both of which have led to arrests. The fire on Park Street as well as a fire on Worthington Street. People of interest were identified in both cases and were arrested with the Springfield Police Department and the Springfield Fire Department Arson and Bomb Squad. So that's all I have for this week. Thank you very much.
Thank you, Commissioner Calvi. We'll now get the update from the Springfield Police Commissioner, Cheryl Clapper.
Thank you, Mayor. Good morning. The police department, as of today, we have 4 out with COVID. That is also a low number for us since November. So we have gone back at the police department to 2 officer cars. We still have a few one-person cars, but most of the vehicles now are back to 2 officer cars. That makes the officers feel safer. There's certain areas in the city that a 2-officer car is much safer than a 1-officer car. So we have gone back while still emphasizing the need to wear your masks, to clean the cars in between shifts, and to certainly clean the cruisers thoroughly in between any type of a transport. So inside has stayed the same. We've still masked inside. We're still clean every day, and we'd like to thank Pat Sullivan for all the cleaning materials and the assistance in keeping the cars in the building at 130 Pearl Street safe. Along with Helen Carlton, Commissioner Carlton, I also am concerned about seniors, and whenever there's a crisis, there are some people who will take advantage of it and not let it go to waste. So we have been getting reports about seniors who have had offers in exchange for money or information to give rides, to assist them, to help them get their vaccination. It's an issue. It's so much of an issue, the Attorney General's office has put a link on their website, and there is a number I will give you to call. The Attorney General's office would like to know if you've had offers, if someone is requesting money or to assist you or tried to get your information. On the Attorney General's website, there's a link for these reports. The number is 617-727-8400. 617-727-8400. The Attorney General's office would like to hear from you if such offers have been made or if anybody is requesting your information. Again, don't give anyone that you don't know any information. Unfortunately, there are people out there who will take advantage of that. So the companion system is really for your close circle of friends and family only. If you know who's taken you for the vaccine, that's fine. That's what the program is for. It's not for someone else who's going to make you give them money or take your information, find out where you live, find out your health insurance information. That we want to know about it. If it's something of urgency or you have any questions at all or you think that a cruiser should respond, please call my office, 911, or the Detective Bureau. If it's a neighbor that you're afraid of and they have been asking for your information or assistance, please feel free to call 911 and we will help you. We will assist with the reporting to the Attorney General's office. Thank you, Mayor.
Thank you, Commissioner. Thank you very much, Commissioner Clapper. We'll get a brief update from the Director of Public Works, Director Chris Signoli, the snow miser. He'll give you an update on any impending storms. Hopefully we can dodge a bullet. DPW Director Chris Signoli.
Mayor, thank you very much. Right now, the DPW has 1 employee out with COVID. Our employees received their second vaccine shots last week, so thank you, Helen, thank you, Mayor, for making that happen. Last week, we had another traffic controller hit and 2 traffic signals knocked down. So we're having issues with drivers out there hitting our equipment again. There has been a huge increase in water main breaks. I mentioned it last week, and there was probably 5 or 6 again last week, and I kind of expect that to happen. While it is not under the purview of the DPW, we do assist Springfield Water and Sewer on that. We are in a very, very big snow, ice, rain pattern. Every 3, 4, 5 days, it looks like we have had, and we will have snow events. This Thursday into Friday, we are looking at a 4 to 6 inch snowstorm. However, as we move through the next day or two, we'll have to see if any of that changes. But right now, we will be looking at a plowable event, most likely Thursday evening and overnight into Friday morning. And that is it with regard to the DPW. Thank you.
Thank you, Director Signoli. We'll now get the update from the Superintendent of Springfield Public Schools, Superintendent Daniel Warwick.
Thank you, Mayor. Good morning, everyone. As the mayor said earlier, I'm very, very proud of my staff and the Sodexo team in Springfield. This is unparalleled in the state. We have provided, since we closed down in March, 6,131,588 meals for our families. Just this weekend alone we did 106,556. So that program, given the issues with this pandemic and food insecurity, I'm very, very proud of my staff on that. Right now, we have a school reopening plan with our first groups scheduled for March 15th, again, subject to negotiations and some other pieces with the school committee and the COVID rates. And that would be our high needs SPED, SLIFE, and vocational, RELL and vocational students. April 12th would be pre-KK, grades 1, 6, 9, and 12. And again, that would be April 12th, again, subject to COVID rates and negotiations and our finishing all our ventilation work, which is going very, very well. The ventilation work, I've been working very closely with Patrick Sullivan on, that we're going through our buildings, and with the support of the mayor, we're putting up to $1.4 million into improving all the ventilation systems. And that work is going extremely well, and very, very grateful for that. Thank you, Mayor. Flu shots, we're still encouraging folks to get flu shots, but they're not mandated any longer. We've got some good news. Our winter sports program, we were able to go. We had one brief pause, but we're able to finish it. In the last testing, with the support of the health commissioner, all of our athletes and coaches were clear and were able to finish the season. The school committee last Thursday night voted that we're going to proceed with a season, what we call Fall 2 season, which is very unusual, but it's going to put our football players back in for a season and volleyball. That's going to start March 1st, so that's an unusual season because we weren't able to offer those sports in the fall other than for practice. So working with our health commissioner, we're going to do some testing sessions. So the testing is going to be February 24th, the first test, and she set up 3 tests like we did for our other seasons, and that really has kept our athletes safe and allowed us to continue with the season. So deeply appreciative to the health commissioner, Helen Carlton Harris, and my team, Jeannie Clancer, my supervisor in nursing, and Assistant Superintendent Lydia Martinez, and our AD, Wayne Early. So far, our staff has done an absolutely fabulous job on the remote program, and to the end of January, our attendance was 92.1%, which is only 1.3% off our regular attendance. So a real testimony to our staff reaching out to families and all the support we had from the mayor and our team relative to getting the technology and servicing the technology for our students. But the mayor came up with all the extra technological pieces we need. So we didn't have any layoffs for school staff to take on the extra expenses associated with COVID. And a last little piece, Eastman, one of our companies, I think the mayor might have mentioned this, but they provided 1,500 lap desks for our kids. A lot of our kids are working, they don't have proper desks and things like that. That's where they could work on a couch or in a bed, but they'd have a plastic-made lap desk to do their work more comfortably. So deeply appreciative to Eastman, Sean Pace, and Tony Signoli for his help with that. And that's all I have. Thank you, Mayor.
Thank you, Superintendent Warwick. The Facilities and Parks Management Director Patrick Sullivan and his team have done a wonderful job, especially when it comes to the retrofitting of our schools and our public buildings on enhancing ventilation and airflow higher than what is recommended in the ASHRAE standards. The Director of Facilities and Parks, Patrick Sullivan.
Thank you, Mayor Sarno. We have 0 out due to COVID, We are completing the work across the city in our school buildings. Next week, we will start inspections with the industrial hygienist. He will verify and certify that we've completed the work to the standards set forth. Sea Arena opened this weekend. I think that's another sign that Springfield's headed in the right direction. And to echo Commissioner Calvi's advice, again, parents and guardians, please speak to your children about staying off the ice. With today's rain, soaking the snow that's above the ice, which is already maybe only an inch thick, it's going to create very sponge-like conditions and very dangerous conditions. So please talk to your children about staying off the ice. Thank you.
Thank you very much, Director Sullivan. As I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan and his team have done a wonderful job to try to keep our businesses afloat and stabilized and prepare them for a post-COVID-19 vision. The Chief Development Officer of the City of Springfield, Tim Sheehan.
Good morning, everyone. Thank you, Mayor. We continue to monitor President Biden's $1.9 trillion relief package. We're especially focused on the $350 billion that's allocated for states and localities. As we know and have said throughout the pandemic week after week, that without flexible and direct aid, the frontline fight in the pandemic, which is local government, will be weakened. We are also watching closely what happens with the broader real estate market trends, especially commercial, as a result of the pandemic. And I also wanted to recognize the tremendous work that the Community Foundation has done throughout the pandemic in getting $10.2 million in aid out to 182 organizations in Western Mass, many of them in Springfield, that continue to provide programs to address housing, nutrition, and economic insecurity. Thank you.
Thank you, Director Sheehan. You received the financial update from my CFO, TJ Plant, earlier, and legal, HR, and labor updates from Solicitor Pakula I gave and Attorney Bill Mahoney. At this point in time, we'll take any questions or comments you have, my cabinet heads or myself, if there are any from the media at all. Audrey? Sure. Commissioner Carlton-Harris and Commissioner Clapper, please. Helen, Ms. Helen? I'll bring up Commissioner Clapper.
I'm sorry, about the Eastfield now? Have we? Yeah, we received a few calls of concern from seniors. I guess they were either approached or called and they don't know the person, so they did the right thing, called 911, and they were advised to, not have any contact. Do they know who it was? We took all the information. And then it started coming to us that the Attorney General's office was so concerned they set up a special website for it. Because like I said, no crisis goes to waste without somebody figuring out how they can benefit. So they set up this website. They are actively looking into anybody who is out there searching for seniors to help wrongfully by getting their information or taking money off of this crisis. So we did, and we know that they're out there on the social media. I have seen them on the social media, people offering to take elderly to vaccination sites, and that's certainly not what that companion was instituted for. The companion rule in regards to vaccinations, close family circles or friends, people that you know. Certainly we don't want to see anybody taken advantage of. So if they have confusion about how to contact the Attorney General's office, they can certainly just call us and we'll help them out. There was one or two reports of the Eastfield Mall of people willing to help as people were trying to stand outside in that line, and we sent cruisers up, we took care of that, and we got people inside. So it was also in person besides social media, yes.
Mr. Carpenter is also here. Yep, sure.
Yes, it is, and I've asked cruisers to watch for that, and I've also asked cruisers to watch for anyone who may be in distress in line, in a car or outside, and that was vaccination sites or testing sites. We know of all the testing sites, we've made special attentions on all of them, and this is why. We understand that right now it's elderly and there could be confusion. So we don't want to see that, and if we can be of an assist, I have put cars in that area for that reason, yes.
Mr. Falcon Harris is back now, Audrey, if you want to ask that. And just to let you know, as Mr. Clapper had indicated, vehicles, we have police officers outside, they're inside also. I was there Saturday, they help assist there, and so they're a common force, and they're also with eyes inside and out for our seniors.
There you are. I couldn't see you. Yes, we have taken 52 calls since this announcement has been made from residents concerned about seniors being scammed. The list that I read to you was sent to me by a Springfield resident who wanted me to see exactly on social media what the outreach was and just how really pervasive it is. It is not just in our area, it is across the Commonwealth, but these types of really disturbing outreaches are happening across the state, but it is our residents who are reporting it to us. Well, the city of Springfield has not opened a community vaccine sites at this point. The decentralized model that we talked about is something that we are hoping to do. As the mayor mentioned, we will be on a call with the state DPH commissioner, and hopefully we'll get some clarity around that. So right now, we are vaccinating the second dose of those individuals that we did initially, that 1,400 individuals. So we have not set up community sites at this point. We do have the second dose for those individuals that we have already vaccinated, yes.
Again, I have, Helen and I have voiced, and specifically to Governor Baker, Lieutenant Governor Polito. I know Helen has the Secretary Mary Lou Sutters, and we'll have DPH Commissioner Monica Burrell on the line, Helen and I on our vaccine message. So we've told them that we have the ability, if we can get our own allotment of vaccines, and also working with Dr. Kerouac, that we'd like to stand up convenient neighborhood sites for our residents. That is still our goal. Commissioner Carlton Harris, Director Sullivan are continuing to move forward in identifying those sites, and that's what we're looking to do. So the governor had said publicly, and he said it publicly Saturday, and we spoke prior, that if the federal allotment continues to tick up, you know, that could be very advantageous, not only for mass sites, but to have cities such as Springfield. We have the capacity and the professionalism. AMR, also Patrick Leonardo, we can do it. And we can, you know, say we can knock off, you know, I don't know if we could end up doing 1,500 a week, but say you get to, and you're doing that specifically for my Springfield residents and making it convenient in those neighborhood areas, or the community center, schools, houses of worship. And I think houses of worship are very important because they're people that are, some are suspect about taking this vaccine, and that's what we'll talk to Commissioner Monica Burrell today about. It's safe, it's sound, trust. We need to take this vaccine. Matt, I know, any other questions or comments? Matt? Yeah.
In terms of where we're seeing for the extra vaccination sites are showing up, I mean, CVS is in 16 acres,
Yeah, that was this morning.
is that, you know, these are, you know, the whole area of Oasis, that basically big wide airline, we seem to be as far away from the concentration of spread like this is. Has there been any, you know, effort to, you know, convince some of these institutions that are currently now have some of the vaccine themselves, that CVS is why, you know, CVS told Mass Live that they were responding to density, which doesn't allow that.
Yeah.
Acres, I don't know if there's any concern about, you know, where we have the access now, it doesn't seem to go anywhere, you know, for lack of a better term, you know,
Yeah, there is a concern. I mean, we voiced where we'd like to, that we have, I think Helen has put together 10 strategic logistical locations across the city. And then we had other areas where Bay State Medical Center has stepped up in the North End area. Helen and I have moved stuff to the Mason Square area. This is on testing. And also to the Orchard, which sometimes is isolated there at Kennedy. We have voiced it high and low that, again, we'd like to see those in more areas that are in need. We don't call the shots on that. That's called by the state administration. I'm glad that Springfield has a site. It's a CVS in the Acres. And, you know, I'm also glad that we have a mass site at the Eastfield Mall. I think the whole key here is, I believe everybody is on the same page. I said it Saturday, Matt, you were there at Eastfield Mall. Our goal is to get as many shots as we can in the people's arms. So if the federal output ticks up as it should, then you'll start to see more of an allotment flow to the local areas on it. So right now you have the Eastfield Mall site, you have the CVS site. I know Dr. Kerouac, he's spoken to Helen and wants to do more stuff in Springfield. We have AMR that wants to do more stuff. And then we would go to 10 locations strategically and logistically located in the city to the harder to reach populations and make it much more convenient for them if and when we get that supply. So we're already putting the plans together moving forward. Any other questions or comments for any other cabinet heads or department heads? Well, again, I thank each and every one of you, especially to the media, to the TV media, to the radio media, to the print media. We appreciate you getting the message out, especially on where the vaccination sites availability is, and also about the scamming of our seniors. I don't think you could play that enough, and shame on those individuals. What if they did that to your mother, your father, your grandmother, or your grandfather, or a family member? You wouldn't like that at all, and I hope you do get caught and set an example with the fullest extent of prosecution. As Commissioner Clapper will indicate, when you violate senior citizens, that crime goes up even higher in sentencing phases. To the residents and business community of the city of Springfield, thank you. I know it's been surreal, it's been an ordeal, but your partnership, collaboration, and patience and understanding has been key to us moving forward to defeat this COVID-19. To my cabinet heads, once again, in rank and file, and their families, thank you. They've been through thick and thin, a number of man-made and natural disasters we've dealt with, tested and true, and I appreciate their efforts. So keep doing what you're doing, okay? The mask wearing is important, the physical distancing is important, the hand washing is important. If you don't feel good, stay home. Try to only stay around the people you have been with. That's extremely important. Doing that combination of prevention, also on contact tracing, when Helen's crew calls you, please give that information. But doing that balancing act and prevention stuff, and meantime, increasing the output of vaccinations going on, we'll move to defeat this COVID-19. So to each and every one of you, good health, and go out and have a great day. God bless. Thank you very much.